the donations there as well. You can pick up donations or you can drop off donations at Beloved. That address is 32 Old Charlotte Highway in Asheville. There are Spanish-speaking volunteers helping at this site. Manna Food Bank. In response to the catastrophic damage caused by Hurricane Helene, Manna Food Bank is launching a critical donation and distribution effort to support those affected across Western North Carolina. Food and water distribution will start tomorrow, October 2nd, from noon to 4 p.m. That will be located at 570 Brevard Road in Asheville, or you can visit mannafoodbank.org to make donations. We thank all of the nonprofits and operations for providing support to the community during this time. Our 911 call center, our call center are receiving support from New Hanover County, Fayetteville Police Department, Stanley County, and Raleigh-Wake. These centers are in the overflow rotation for our 911 calls. And I do want to offer a heartfelt thank you to all the county, state, and nonprofit partners who's been helping us throughout this endeavor. It has been a long journey so far, and I know it's going to be even longer. So this is definitely, guys, not a sprint. It will be a marathon as we try to recover from this disaster. So a heartfelt thank you to both nationally and local nonprofits for helping us out. Thank you. And with that, I'll turn it back over to Lillian.
Thank you. Next, we're going to hear from Scott Dean, BEAN, with the National Urban Search and Rescue Team that is here helping us.
Good afternoon, everybody. To be transparent, this county and this state and 3 other states with Florida, Tennessee, and South Carolina have major devastation. In this county alone, I could tell you it's miles and miles of complete devastation. So we do ask that locals be patient with our first priority is always going to be first in search and rescue. Currently, we have local fire, local police going out and doing surveys as much as they can to the areas that they can get into that are not devastated through road closures because of water, removing the roads or removing the bridges. We have several amazing local and state EMAC and search and rescue teams on site operating. And then we have 19 federal urban search and rescue teams within the state of North Carolina operating to really get to where we can and help as many as those that we can get to. We are working on getting to those that are impacted that they can't get out so that we can get in and get supplies to them until we can get the roads clear so that they can get out. For assistance, immediate assistance, we encourage you to email disasterassistance.gov. You can also go to the FEMA mobile app, or you can call the FEMA helpline at 800-621-3362. I will tell you it's a complete devastation out there, and we are working really hard to get to everybody so that we can get them some closure and get to their families so that they can make the phone calls to let them know that they are safe. We're dealing with a lot of major issues from bridge closures to no power, no water, just complete infrastructural failure. And I will tell you the local governments, the state government, the national government are all working really hard to get to everybody that they can to help. This is the time when neighbors need to help their neighbors. If you can go out and help your neighbor, please do so. This is where, as a country, we come united and we help one another and we help our brothers and sisters down the street, because we cannot do this alone. Don't rely just on first responders to help you. Everybody needs to work together for a better outcome on this one. So we truly appreciate everything that everybody is doing, all the volunteers that are out there. Keep doing it and keep providing assistance to your loved ones and your families and your friends and your neighbors that are out there, because they're going to need it during this time. Thank you.
Next, we'll hear from Dr. Jennifer Mullendorf, Buncombe County Medical Director.
Good afternoon. I'm going to talk today about medications and then also food and water safety. So we know that many of you have reached out offering to donate medications to the effort. ABCCM's medical clinic at 155 Livingston Street in Asheville is accepting donations of medications from 9 a.m. to noon, Monday through Thursday this week. There are requirements about what medications can be donated. Only sealed manufacturer bottles that are not expired, do not require refrigeration, and are not in amber orange prescription bottles. They don't accept controlled substances or cancer medications. So if you have those types of medications that you wish to donate, so sealed manufacturer bottles, not expired, not requiring refrigeration, not controlled substances or cancer medications, you can take them to the ABCCM Medical Clinic at 155 Livingston Street between 9 a.m. and noon, Monday through Thursday this week. The ABCCM Medical Clinic at 155 Livingston is also providing primary health care to all adults. Typically, this is a free clinic for uninsured individuals, but at this time, they are serving all adults. If you have medications that need to be refilled, the North Carolina Board of Pharmacy is maintaining an online list of pharmacies in Western North Carolina that are open. This list is updated by the Board of Pharmacy every 30 minutes. I will say that we are aware of some pharmacies in the area that are open, but not on the list. So for example, Mission Hospital's outpatient pharmacy at 509 Biltmore Avenue, entrance number 4, is open 24/7 to fill prescriptions. They do close from lunch to noon, or not, they do close for lunch from noon to 1 p.m. daily. They are not filling prescriptions for controlled substances. If you are a pharmacy that is open and providing services, we do encourage you to notify the Board of Pharmacy via email at emergency@ncbop.org if possible, or via the online form on their website. Again, because I know that some people don't have access to the internet at home, like myself, I'm going to read a list of the pharmacies that are currently listed as opening, so bear with me. The CVS Pharmacy at 505 Smoky Park Highway. The CVS at 324 Long Shoals Road in Arden. Pinnacle Apothecary in Candler. They're open Monday through Friday, 10 to 4 until they resume power, and then they'll go back to normal operation hours. PSA Pharmacy at 2294 US Highway 70 in Swannanoa. Publix Pharmacy at 1830 Hendersonville Road in Asheville. Publix Pharmacy at 165 Weaver Boulevard. Walgreens at 2501 Hendersonville Road in Arden. Walgreens at 1835 Hendersonville Road in Asheville. The Walmart Supercenter Pharmacy at 60 Airport Road in Arden. The Walmart Supercenter Pharmacy at 25 Northridge Commons Parkway in Weaverville. And the Walmart Supercenter Pharmacy at 1636 Hendersonville Road in Asheville. You can visit buncombeready.org for more information. And because we are in a state of emergency, there are different rules for filling prescriptions. So these emergency rules allow people to go to any open pharmacy with their prescription bottles to get a 30 or 90-day refill on their medications. You do not have to go to your typical pharmacy. And these rules also allow the pharmacy to refill the prescription even if you have no refills remaining on that bottle. These types of emergency refill procedures cannot be used to fill prescriptions for Schedule II controlled substances. These include things like pain medications containing hydrocodone or oxycodone, and ADHD medications like Adderall or Ritalin. Additionally, all health insurance plans that are licensed to operate in the state are legally responsible to allow and cover prescriptions that are otherwise being filled too soon by people who reside in an area that is subject to an emergency declaration. Additionally, it is okay for someone other than the patient to pick up the prescription. While some medications may require the person picking them up to have a valid copy of the patient's ID, this is not the case for most medications. In terms of those who are sheltered at the Western North Carolina Ag Center and AB Tech campus, I do want to call out some great partnerships that have been helping get those people medications when they can't leave the shelter. So MAHAC has been writing and prescribing medications at shelters, and the Charles George VA Medical Center has sent pharmacy teams to our shelters to help serve displaced vets. So I really want to thank them for that. Now I'm going to go over some information about food and water safety. So water. Only potable water should be used for drinking, food preparation, washing dishes and hands, brushing teeth, bathing, and showering. Potable water includes bottled water or other water, like in the tanker trucks, that's labeled potable. If you are on a municipal water supply and under a boil water advisory, and you're getting water from your tap, you should boil your water for 1 minute. If you are unable to boil your water, you can add 8 drops of bleach to a gallon of water. Water should not be taken from creeks or streams to be used as potable water. So that water should not be used for drinking or washing hands or brushing teeth or bathing and showering. That water, that non-potable water, can be used to flush your toilets sparingly. We don't want you to use non-potable water to wash your hands or cook or bathe because that could make you sick. You can also use body wipes or baby wipes to wipe your hands. You can use hand sanitizer. And we're trying to make these resources available. For food, so prepared food, lunch meat, milk products, soft cheeses that were unrefrigerated for more than 6 hours or left out of coolers needs to be discarded. Raw meat products that are cold to the touch and unspoiled can be consumed if they are thoroughly cooked. Seafood, raw seafood, needs to be thrown out. Consumers with food safety related questions can reach out to Safe Plates at 919-515-9842 for additional guidance. All food service operations that are experiencing a loss of water, power, or sewer may not operate at this time unless they are operating under an emergency operations plan that has been approved by Buncombe County Environmental Health or the North Carolina Department of Health and Human Services Environmental Health Section. If you are a permitted or licensed facility regulated by Buncombe County Environmental Health and you have specific questions or concerns, you can reach out to the North Carolina Department of Health and Human Services Environmental Health Section at 919-707-5999 or by email at ehpreparednessquestions@dhhs.nc.gov. And we appreciate their assistance. Thank you.
Next, we'll hear from Sheriff Quentin Miller. Before we do, I just got a message from Biltmore Forest that they are distributing water at Carolina Day School today until 5. That's at 1345 Hendersonville Road. They will be there again tomorrow from 10 to 5 to distribute water. Also got a request from Duke Energy to remind people as power is coming back online, please, we know there are a number of down power lines across the county. If there are down power lines, do not drive over those down power lines. Consider all of those lines to be active. We also got an update from MSD, the waste treatment facility, and they wanted us to know that the plant has been operating treating the whole time. They had to go on backup power, but are now on utility power. All major lines are working, and 37 out of 40 pump stations are working mostly on backup power, with staff ferrying fuel to the generators. 3 remaining smaller pump stations are still underwater. They are still without internet and potable water from Woodfin at the MSD campus. They have a few crews, plus their contractor, helping Woodfin Water to try to rebuild the road to their plant and to find the major leaks and breakages in their transmission line. In the coming days, they expect many problems throughout the system. Next, we'll hear from Sheriff Quentin Miller.
So good afternoon. I have the unfortunate task to confirm now that we have a total of 57 confirmed deaths. Next, I just want to thank our partners, both state, local, and federal partners, for assisting with our wellness checks and our jail operations to support. Your support is crucial in us being able to maintain our functions that we must do. Despite the challenges, Buncombe County Sheriff's Office continues to answer calls and keeping our community safe. Our teams are dedicated to protecting every resident, both in the community and in the jails. With our partners, we're stronger and able to maintain a high standard of public safety. We're committed to transparency and ensuring public safety remains our top priority. We're here for you, and we'll keep working around the clock to serve and protect our community. Thank you.
We've also received an update from Woodfin. They want to let folks know that water distribution is happening at North Windy Ridge School near I-26 at exit 17. Bring your own container. Food is available Wednesday, October 2nd at the Methodist and Baptist churches on Main Street. Those times are unknown. Pantry items and bottled water will be distributed at the community center above Lake Louise on Wednesday, October 2nd from 10 a.m. to 2 p.m. Water and pantry donations are accepted Wednesday, October 2nd from 3 to 4 p.m. Their curfew remains in effect from 7:30 p.m. to 7:30 a.m. At this time, we'll open it up to questions. I do want to let folks know that Ben Woody, Assistant City Manager for the City of Asheville, is available here if there are any questions that pertain to the City of Asheville.
Lucas Tomei with Carolina Public Press. I have a public health related question. Are there any concerns public health wise with standing water? I know, for example, some of the coastal counties on our state have been dealing with increased mosquito populations.
Are you still there?
It's Dr. Mullendor, Medical Director for Buncombe County. I'm not the environmental health specialist, but yes, I mean, we do know we have mosquitoes in our area, and standing water is a source of, breeding for mosquitoes. So yes, I mean, we would encourage people to use the appropriate precautions, repellent, and long sleeves, long pants. If you're able, now we can't do much with puddles and things like that, but if you do have like standing water in buckets or potted plants or anything, that you can tip and toss, we ask that you please do that. But I can certainly reach out to our environmental health colleagues and get additional information for you.
Hi, Jeff Chamber with the Charlotte Observer. I'm looking for clarity on the delay of water delivery. I reached out to a colleague reached out to NC Emergency Management, and they said that supplies were delivered between September 27th and 29th. I'm wondering, when did the county make the request for supplies? What days? And is there a chance that maybe the supplies were taken by mistake by another city, like if they were delivered to Asheville or something like that? Any idea what might have happened there?
Absolutely. Give me one moment and I can pull up that time for you of when the request was made. Of course, the request being made versus the supplies arriving are two different things, right? And both of them can be true. The request was made for water ahead of the storm. The first request was made through the state emergency management system at 4:49 p.m. on September 26th. Now, remember, not all water requests are for public consumption. They also go to our partners who are taking care of children, our school districts and schools. So those supplies were requested on September 26th at 4:49 p.m. September 27th in the early morning hours is when our catastrophic flooding began. All interstates became impassable at that time. Air traffic was grounded at that time. And on September 28th, supplies began to arrive by air late in the day. And then they arrived by trucks late in the night. Again, those supplies were not just for Buncombe County, but for other communities in the region that were impacted by this. And they were also for the other agencies that support. Buncombe County had a storage supply of water that was in Swannanoa. And unfortunately, due to the catastrophic flooding, we could not access that water supply after the flooding began that morning.
This is Laura Lee at Blue Ridge Public Radio. I wanted to ask about trash pickup or disposal of trash. This is something that a lot of people are facing right now. What can we tell them?
Absolutely. When we had Woodfin on our call earlier this week or over the weekend, they shared that the Kirby facility had received massive impacts from the storm and wasn't operational. We know that our Hominy Creek transfer station is not operational and we have no ETA on a restoration of that. And so the only option is the landfill. Our community service providers have no ETA on when they'll be able to resume trash service in the community. And then there's the added layer of debris removal from the storm. Those are all pieces that we're working through, and we'll share that out as soon as we have answers. But at this time, unfortunately, we have none.
So just to be clear, the landfill is not an option at this moment?
The
For people to
landfill
take
is an option.
the landfill is an option for people to take their trash. Great. My other question
Yes.
was about the boiling of water for people who have the few people who have water services. Am I correct to understand that they need to boil that for things like bathing, washing dishes, any use of the water, it needs to be boiled? Is that right?
That's correct. Brushing your teeth, any interaction that you have with that water, you need to make sure that it has been boiled.
And one other question, we've posed this to the Postal Service, but wanted to know if you have any updates locally on mail service.
We're hearing reports that some individuals are receiving mail. It is very dependent on roads, where you live. In town, in Asheville looks much different than other parts of the community, like we heard from our USAR representative. And so mail service is going to not be a sudden switch on after it became a sudden switch off, but will gradually increase in the coming days as roads are cleared and power lines are removed. There are some roads that are still too dangerous to pass.
This is John Boyle with Asheville Watchdog. I know we have gone back and forth on this water issue. I still remain confused because Ms. Pender has said twice the county did not receive water until Monday morning, which conflicts with what the state says. So either there was water distributed at 6 sites or there was not. Can you clarify that?
I'm looking to Avril's grabbing a document real fast. I'm going to pass it to her. I want to be clear though, John, in our last media opportunity, you referenced a bureaucratic snafu. There is no bureaucratic snafu.
Thanks, Lillian. Hi, John.
Hello again.
We did receive water Monday morning at 2:30. So when I'm referencing Sunday night, the 29th or the 30th, it did land here for Buncombe County at 2:30 a.m. Monday morning, the 30th. So so when I'm saying it received Sunday night into Monday morning, that's when we got the water that was specific for use by Buncombe County.
Okay, so you're not aware of the state bringing in water and distributing it at 6 sites throughout the county on the 27th and 28th?
Not for mass distribution for Buncombe County residents. If it came in for 6 sites, they were specific for that site, maybe different locations, but not that we requested for mass distribution to Buncombe County residents. That water came at 2:30 a.m. on Sunday morning, which would be referenced in a Sunday night into Monday morning.
Thank you. I have a follow-up question, a different question for Ben Woody, not for you, April. I'll let you off the hook. Trying to get Ben Woody.
Here I am, John.
Hey, Ben. Hey, I know you guys have been crazy busy and working around the clock. We've had a couple people asking more out of curiosity than anything why there has been a lower presence of city officials at these briefings than the county. And I think it has to do with the structure that's set up, but I'm hoping you can explain that a little bit.
Well, John, I'm here today to talk about the water system, so I'm happy to answer a question on that if you have one.
When's the water going to be back on?
It's going to take us weeks. We've covered that at our briefing yesterday. Thank you.
So can
And I do want to speak to that. These are county briefings that we've been bringing in multiple partners, as you've seen, since we started these briefings last week. And so there are a multitude of different information specialists who we want to make sure that our community is hearing from, and that we represent all of our municipalities and agencies in this process. Next question.
Yeah, I have a question for Sheriff Miller. Sorry for using your first name. My question is, there was an incident on Sunday before water was delivered in which some residents found a semi-truck with cases of water and began distributing them to people nearby. And a law enforcement officer walked up and said that they were stealing and made them leave. I'm wondering if you agree with that, or do you feel that that was them surviving, considering water wasn't delivered until the very next day? What is your opinion on that assessment by that officer?
Well, I'm not sure which officer. I'm not going to get into opinions. I like to state the facts. And again, I'm not for sure, but I will follow up and investigate that incident and then get back to you.
Well, in terms of facts, then, do you consider that stealing or no?
Stealing is stealing. I mean, it meets the elements, it is.
So it is stealing, or
Looting.
I mean, if people didn't have water and they were desperate.
I think we're now getting into schematics, right? I would tell you that we're going to enforce the statutes that are on the books.
Sheriff Miller, while you're at the podium, could we ask you about conditions in the jail? We have some reports of degrading conditions there, some reports of potential self-harm. Is there any update you can give us from that?
Yes, I would just simply tell you that our jail operations are normal for us. We have not received, I've heard some of the information that's out there, which I will tell you is false. And I will tell you that we continue to conduct ourselves at the detention center as if it's normal.
Do we have any questions in the chat?
We do. From the chat, we're hearing a lot of questions about medical supplies, specifically oxygen, and how we are coordinating efforts for medical supplies and distribution.
So I'm going to ask Dr. Mullendor to come forward. I know insulin is also a question that we've been getting from community members through our social media questions. We don't have all the answers, but we may be able to provide just a little bit of guidance.
So we have been getting requests for medical supplies from the community in the Emergency Operations Center. We're sending those requests through our, to our logistics staff and trying to make connections between resources. We have had people reach out and offer things like insulin, and we're just asking people to go through the channel of Helene donations at buncombecounty.org if they have something, and we are, managing those requests. Again, insulin has to be refrigerated, so that is a concern with that. I can't really specifically answer your question. Just know when we get these requests, we're pushing them through the process in the EOC and trying to fulfill them the best we can.
We've also had questions about rainwater collection as safe for drinking and whether well water needs to be boiled.
Rainwater is not safe for drinking under any circumstances. Is that correct, Dr. Mullendor? It should be treated as a non-potable water source and is appropriate for flushing toilets, but not for human consumption. For the second part of the question was well water. Well water should be an acceptable drinking water source if you were drinking it previously.
What is the status of Swananoa and Black Mountain and Biltmore Village in the River Arts District?
County Manager Avril Pender is going to answer that.
I actually drove through the Black Mountain today and visited with the town manager there, and they do have their AOC up and running. There's lots of work to be done in all parts of our county. Went to Biltmore Forest as well, and there's lots of work to be done in Biltmore Forest. As far as Biltmore Village is concerned, there's no more standing water on the roads, but it is still blocked off because there's a lot of devastation in that area. There was massive flooding in Biltmore Village. But we're working through that. We have our partners there. You cannot drive through Biltmore Village all the way from Hendersonville Road all the way through, but there is lots of work to be done. And it's going to take us a while to get that done. But the people are strong. We talked to both managers in those areas and they're doing okay, health-wise. But there's lots of work to be done and I cannot say that enough. So please, be patient. I've said that as many times as well. We will come back. We will come back stronger, but it's going to take us time to get there. Any more in the chat?
The next one from the chat is asking about how the deceased are being handled and if there's discussion about mobile morgues or how is that effort being coordinated?
Yes, there is discussion about mobile morgues and we do have, if you recall back in 4 years ago, and I guess 4 or 5 years ago, it was COVID time. And we did get some assets where there are mobile morgues in our inventory. And we have that at our disposal. We've been working with our state partners, with state emergency management as well around mobile morgues. And a regional conversation has been happening around how do we treat our loved ones that has lost life in this tragedy. So the short answer to that question is yes, we are talking about mobile morgues and we are also utilizing any funeral homes. We have the morgue at Mission that we've also been utilizing. But that will be the short answer or long answer to that question.
Can you give us an idea about the percentage of area search crews have reached?
I do not have that information. Do you have that, Dean Scott? So we'll have our national USAR person.
I could tell you that we're getting to as many areas as possible. It is unified. We have state resources with the local fire and the federal resources on the ground all over the county, but all over the state as well, trying to access these areas. You really got to understand this is widespread devastation and the magnitude to get in is extremely difficult because not only did you have wind damage with trees falling down, with lines of power lines installed with it, where now we can't cut trees down because we make sure that the lines are not charged because for every action, there's a reaction. If we cut the lines, then the people in those communities are not going to get power for that much longer. So we're working with every municipality that's involved to get to every area as quickly as possible. So we have several teams on the ground working nonstop to get to those loved ones. I can't give you a definitive number where we're at, but I will tell you we are all over this county right now trying to get to every place that we can, using from on the ground with boots on the ground to side-by-side vehicles to 4x4 trucks to air operations. So we're using every resource available to us to get to those loved ones that we can.
Scott, before you go,
Yes, sir.
John Boyle again with Asheville Watchdog. Can you say, just from driving around a little bit in social media, it appears obviously Swananoa particularly hard hit and possibly Fairview, in some areas less so, like downtown. Can you speak to where most of the fatalities have occurred geographically?
The fatalities I cannot, that would be local. I got here 2 days ago and went straight into operations. But I've had an opportunity to work with the local SMEs of this area. And everywhere we've gone, it's complete devastation. There's no one place we've been that there hasn't been severe flooding. So, the big go back here is really when local officials tell you early on before something happens to, really listen to the directions that they're trying to give you so that we're not in these kind of little predicaments of trying to find a lot of people we just don't know that didn't leave. So we are working very hard to try to find everybody that is missing, and working very hard to get those people that are not missing, but just not available to get to because of the road closures due to either being washed out or the bridges being washed out. So we are working really hard. And one thing I got to really stress is it's one thing to come into a community and not have really an emotional involvement, like specifically where my particular home, but your local authorities have their own impacts that they're dealing with at home that they've left to really help others. So you really got to understand the emotional part of this for those first responders in your communities. They have the same issues at home, but they're not dealing with that so they can help their neighbors. So it really is critical now that everybody in the community is helping one another and not really pointing fingers, but trying to help one another.
Thank you.
Scott just used the acronym SME, State Medical Examiners. No, subject matter experts. Other questions from the chat?
We have additional questions about Wi-Fi service in Buncombe County, specifically in West Asheville and Candler. Are there any libraries or other civic buildings standing up Wi-Fi open to the public?
We don't have any information on that at this time. As we start to regain power, there will be more opportunity for us to use those libraries as Wi-Fi hubs, like we did during the time period of COVID when folks were asked to stay at home.
Can I ask a quick follow-up to that? Or do we have any additional information from the network providers that brought in satellite options in a couple of places? Are there plans to expand that? Have you been in communication with those companies?
We do have the portable cellular unit that is in the parking lot at 35 Woodfin. And so we also are hearing of Starlink operations that are being brought in. I see. Okay. I'm getting confirmation that we have multiple teams coming in to help provide that connection. Yes. Next question.
Questions about veterinary services?
We don't have any additional information about veterinary services at this time. And we will look to get some information about that to share out. And so go to buncombeready.org where we can place that update, and we'll include it in future information if we gather it.
We have a question in the chat about the water reserve supplies and why they weren't relocated ahead of the storm from that warehouse.
That warehouse has long been our connection for water supply during emergencies. We couldn't get to that warehouse because of the flooding with the Swannanoa River. And so with that, the expectation was that we would be able to access that in a timely way. Not what ended up being true for all of us in our own experiences during this natural disaster.
There is a report in the community of a possible propane leak near the Oakley community. Have we had any confirmation of that? Is there any danger to the public or confirmation of a propane issue at Holston Gases?
Ryan Cole, Assistant Emergency Services Director, is here to respond to that.
We did receive a report of a propane odor of propane during the height of the incident, at which time Asheville Fire Department, or right after the incident was over, Asheville Fire Department did investigate that and had people in the area. However, if you still are smelling or start smelling propane, please call in to the 911 center so that we can send additional units out there. So anytime that you have that odor, be sure to report that so that we can go investigate it. But we have investigated that whenever it did come into the or to the state EOC.
Coming up close to the 1 hour mark, do we have additional questions?
New portable toilets were brought downtown. Was that a county effort? And are more portable toilets expected elsewhere in the county?
New portable toilets were brought downtown to support emergency operations staff who are working 24/7 on this response. Like Scott Dean, who was here just a little bit ago, Assistant Emergency Services Director Ryan Cole. And so those portable bathrooms and showers that are downtown, outside of the health department building, those are for emergency personnel use and are not public toilets. We are looking to bring in more, but we've got to make sure that our emergency responders can keep going out on those calls.
Many service workers are out of work, possibly for weeks. How is the county providing support for these workers? What aid or assistance is available to them?
I'm going to turn this over to Avril Pender to discuss that.
Thank you. Thank you for the question. We have set up a donation site. That is the Helene donations at buncombecounty.org. We are gathering whether that is stuff or money so we can help out. Similar to what we did in COVID with the One Buncombe Fund. We don't have a fancy name for this fund, but it really is just Helene donations at buncombecounty.org. And we are working to gather that so we can get it back out to our community. We have a team put together, United Way is in the room helping us out, so we can come up with a plan of how we can get that funds out to workers that are not working at this time. That is your last question. Thank you, and I'll let Lillian close us out. Thank you.
As a reminder, we are less than 1 week into this significant catastrophe, and so there will be some questions that are asked that we don't have all of the answers to, but know that we've got a whole staff of folks in our emergency operations center who are working to get these answers, because we know that the crises are natural, they're environmental, they're emotional, and there are a number of different organizations that are all at the table to work for our Buncombe County community to get these solutions. So that's why you'll see a number of folks coming towards us. And if you have suggestions for people you'd like to see, drop those in our Facebook comments, and we'll be sure to try to get those folks on the call moving forward. Thank you for being here. We'll be back at 10 a.m. tomorrow, Wednesday, October 2nd.